for your family members and for you is to encourage you to follow the health officer's order that residents stay in place where they can be cared for and carefully monitored. We continue to express our condolences to any families who have lost loved ones during this COVID-19 crisis. And we're going to continue to urge you to follow the health care orders and to stay in place to maintain the social distancing. This is the only way we are going to be able to continue to battle this insidious virus. After statements by Dan Petticord and by Dr. Farnatano, we will be taking questions at that time. And I want to, again, keep a safe distance, wear a mask. We're doing the same today. It's a good way to prevent the spread of this insidious virus. So first, I'm going to turn the time over to Dan Petticord, our Public Health Director.
Thank you very much, Supervisor Anderson. On Tuesday, March 31st, Contra Costa Health Services Public Health became aware of multiple reports of a COVID-19 outbreak linked to a 47-bed skilled nursing facility in Orinda, that is a community in central Contra Costa County. To date, 27 persons associated with this facility have tested positive for COVID-19. Our initial investigation revealed 5 cases of COVID-19. 2 of those persons were residents of the facility and they are hospitalized. We're not aware of their current situation, or their current condition, rather. 3 additional persons are staff of the facility and they are now on home isolation. Subsequent to our initial investigation, we dispatched a team to do testing at the site for all residents and staff who were there at the facility. To date, those have revealed 22 additional residents that have tested positive for COVID-19, bringing the number to 27. In addition, we are investigating several other reports of positive COVID-19 cases associated with other sensitive occupations and setting, and let me describe briefly what we mean by that. A sensitive setting would be a place like a nursing home, congregate care facility, assisted living facility. A sensitive occupation would be someone like a health care worker or a first responder. In these kinds of situations, our immediate task is to work with the facility in an attempt to decrease the risk of continued transmission of the virus. To that end, the Orinda facility has asked us for technical assistance, and we are very much in support of our guidance in terms of managing this outbreak and reducing the risk of ongoing transmission. I would now like to turn it over to Dr. Chris Farnatano, who will talk a little bit about the specifics of what we're doing in this situation. Thank you.
Thank you, Dan. So in this facility, residents who are positive will be isolated and separated from the residents who have tested negative and are asymptomatic. We have advised that the staff do not intermingle between these 2 groups, rather that dedicated staff are assigned to work with one group only. If other staff do test positive, they may be placed on home isolation. We have availed our testing services of the Public Health Department to that staff to aid in that regard, and we'll continue to offer our testing to any staff that becomes symptomatic in the coming days. It's really important that we monitor the staff who have worked at this facility in the last 14 days, which is the full incubation period for COVID-19. In order to preserve staffing, which is one of the most critical resources in these type of situations, our healthcare workforce, we've advised the facility that asymptomatic staff members who have tested positive may continue to provide care to those residents who have also tested positive, providing they wear the appropriate personal protective equipment at all times and not intermingle with residents or other staff who are caring for the residents who have tested negative on the other part of the facility. In this type of situation, our immediate task is to work closely with the facility, which we are doing, in an attempt to decrease the risk of continued transmission of this virus to other staff, other residents, or outside the facility. To that end, we are going to continue to conduct ongoing testing for residents to identify potential new cases. We have directed the staff at the facility to wear masks and other appropriate protective equipment at all times when working directly with the residents. Additionally, we are providing training on the proper use of this personal protective equipment in this kind of situation to the staff. In anticipation of the need for additional protective equipment, masks and so forth at this facility, we've made a request to the County Emergency Operations Center for masks and equipment, and we've already delivered a large supply of that equipment yesterday, and will continue to support the ongoing needs of this facility for PPE or personal protective equipment. We've re-emphasized with the staff the importance of social distancing, hand washing, and respiratory hygiene, and for staff to very closely monitor all the residents for the earliest symptoms, and also to monitor themselves for any kind of early symptoms of illness and stay home at the first sign of illness. We've previously directed all skilled nursing and assisted living facilities throughout the county to stop all group interactions of residents, such as group meals or social activities, and that's been going on for several weeks, and to not allow visitors to frequent the facility except in extreme circumstances, and that's also been a recommendation in place for several weeks. The important thing about this is COVID-19 is a disease with no proven medication treatment and no vaccine. Our primary weapons against this pandemic virus are isolation and quarantine of known cases and their close contacts, and for everyone else in the community to strictly follow these stay-at-home and social distancing directives. This is why I, on Tuesday, along with other Bay Area health officers, extended the stay-at-home order until at least May 3rd and added stricter requirements on who must stay at home and what must be done to social distance. Today, I'm also issuing a strong recommendation for the general public to cover their face with a cloth mask, bandana, or other cloth material when they do have to go out of their homes to leave for essential grocery shopping or going to work in an essential business and are near others. This is in addition, not to replace, but in addition to all the other social distancing measures that we have in place, such as the hand washing and the staying 6 feet away and not going out in public when you're sick and all those other things. And this is due to our evolving understanding of the virus, which now suggests that covering your face in public, in addition to these other measures, can help reduce the spread. This is how we as a community can protect our most vulnerable in our community by slowing the spread of COVID-19. So remember, for everyone, we need to stay in place, maintain your space, stay 6 feet apart, and cover your face. Thank you. And I think at this time we'll take questions.